Today we'll be covering the 2017 Hospital's Guide to Secure Mobile Messaging. We'll have Jason Stanland, the Manager of Mobility Solutions at Spoke, and also Alan Cassidy, Director of Business Development at SpectraLink. And these experts are with us today to share who, why, and what are necessary for a successful secure mobile messaging project. I do have a handful of housekeeping items before we get started. Everyone will be muted during today's webinar, but we still want your participation. Please submit your questions via the questions box, which is over in your GoToWebinar toolbar. And then Jason and Alan will answer as many questions as time allows after the presentation. We'll also be doing a series of live polls throughout the presentation, so we'd love to see your participation on those as well. A recording of this webinar and the presentation slides will be sent to all registrants tomorrow, so please feel free to share these with others at your organization as well. And lastly, you'll have the opportunity to complete an evaluation at the end of the webinar. We would love it if you could take a couple of minutes to complete this survey. We truly do take your feedback into account, and your thoughts help our efforts to provide relevant and informative presentations. And with that, I'd like to turn it over to Alan, who will begin our presentation. Alan, you might be on mute.
There we go. How's that, Paige?
That's perfect. We can hear you bright and clear.
Okay, great. Thanks very much, Paige. And thank you, everyone that's joined today for this opportunity. Jason and I are going to share some perspectives with you and hopefully give you some good ideas. So let's just jump right in. You know, data security is always present in the minds of hospital CEOs, IT leaders, and others who work with hospital technology. These security concerns include how to protect and secure mobile communications, especially when the doctors, nurses, and other healthcare professionals share protected health information, or PHI. So you can see on this slide, 81% of CIOs are currently focused on strengthening data security, and 55% of hospitals are currently using secure texting solutions to address unsecured mobile messaging. If carefully executed as part of a larger mobile strategy, secure texting apps can be highly successful to secure clinician messaging and support patient care through integrations with other key hospital systems. But many secure texting initiatives fail to bring the desired results, and end users can resist or outright reject the new tools. So in some cases, you heard maybe of caregivers actually putting their mobile device in the drawer just out of frustration. So why does that happen? So we'll go to the next slide, Paige. So sometimes that happens when projects are poorly designed without the larger hospital goals and without considering the three legs of the stool: the people, the process, and the technology. So each of these components are really important, and they are essential to effective change management within the hospital. Applied specifically to secure texting, the value of texting for end users comes from the ability to improve staff workflows and clinical outcomes. Today, we're going to focus the rest of our discussion around these three areas: the people, the process, and the technology needed for a successful implementation. So this next slide is interesting because if you use this analogy, when you're selecting a texting app without considering the mobility strategies, the communication infrastructure, and the security policies, it's almost like picking a mode of transportation without knowing the distance, the terrain, the required speed of where you're trying to go. There's lots of options to get a traveler from, for example, from New York to Los Angeles by plane or car or bus, bicycle, horse, even inline skates. But if your traveler needs to make the trip in less than one day, you could hand them a bike and ignore the solution that you gave them to find another way. But how do you achieve success with your secure mobile messaging initiatives Well, the way you do it is by starting with the larger goals of the hospitals and getting the right people in the planning team and asking the question, how does the mobile technology help each of us reach the bigger picture goals? So let's go back to the transportation analogy for a second. So if you know the destination and the parameters of what you're trying to accomplish, it's important to select the right tools to support your traveler. If you knew at the beginning of the trip that your traveler needed to make the trip in less than 1 day, you would have selected the appropriate method at the beginning instead of maybe offering a bicycle. Equally important is recognizing that you have another class of traveler that's less concerned with the time, but they might be terrified to fly. So you might want to make a different suggestion, like maybe a bus or a train or a car could be a better fit. Similarly, there are different mobile needs throughout the hospital, and different mobile communication technologies work better for maybe a radiologist than they might for an emergency department nurse or a member of the transport staff. Mobility strategies should be built upon the larger, big picture business goals that are set by the executives in the hospital. Maybe you want to tackle the problem of reducing the door-to-doctor time in the emergency department by 15%. Or you'd like to reduce the patient discharge process time by 30 minutes. Or you'd like to improve the physician satisfaction score with the patient by 10%. These metrics have to be clearly defined, and you have to get all of the members of the team to agree on what are the big picture goals and what are the appropriate metrics to set as the goals that you're trying to accomplish. This can set the stage to identify what research is necessary so that the stakeholders can be involved in the planning at the very beginning of the process. And more importantly, how the success of the overall plan is going to be measured. So on this next slide, the sweet spot or the intersection for secure mobile messaging success is where the mobility strategies, the security initiatives, and the existing communication ecosystem overlap. The most successful secure messaging initiatives support the overall hospital goals for mobility. They align with the security policies, and they complement the communication infrastructure that's already in place. This is so important to make sure all of these things are incorporated into your plan. Today we're going to explore, as Paige suggested, the who, the why, and the what would be necessary for these projects with a step-by-step guide for securing the secure mobile messaging rollout. So I think we're going to stop here for second page, and we're going to do a live poll. Is that correct?
That is correct. So you should see that poll up on your screen. The question is, would you consider your secure mobile messaging project a mobility initiative, security initiative, communication initiative, or a clinical initiative? So if you want to go ahead, we'll leave it open for a few seconds here just to get everyone's answers in, and then we'll share those results live and kind of talk through what they mean. Looks like we have several coming in, so I'll leave it open just for a few more seconds if you want to go ahead and get those answers in. All right, looks like we've got the majority. So you now should be able to see the results, Alan.
Okay, let's take a look. And isn't this interesting? Okay, so 46% of the people said it's communication oriented, followed by security, and then mobility, and then, the clinical, and then mobility. So interesting. I guess it really depends on your own perspective. So if you're a member of the telecom or IT staff, you may have one perspective, and if you're a member of the team that's from the caregiver side or the clinician side, that might give you a different perspective on how you answer that question. So that's pretty interesting. Do you have any thoughts on that, Jason?
I agree. I'm quite sure it has to do, Alan, with the perspective. I think the important thing to look at here as well is that we do have people kind of voting in all these different areas. So perhaps we have a broad range of representation in terms of the attendees on the webinar today. And it just kind of goes to drive home your point that it is really important to think about all of these things, communication security, and mobility initiatives. And ultimately, I think all those things drive toward, as you talked about, looking at what outcomes you're trying to achieve ultimately transforms this into a clinical initiative. So definitely some interesting results. I think it shows a lot of different perspectives.
Great. I completely agree with you. Okay, so now we're going to transition into the people part of our discussion. And, so after you've evaluated your objectives, you've formulated a team of getting the right stakeholders, the right people involved. Now the planning for the overall team is really the key. So the next slide, who really should own the project? And this is going to vary greatly from hospital to hospital. But when it comes to determining which department actually owns and drives the mobility plan, I would say every hospital I've been to has been a little bit unique. Each hospital has a lot of pride in the way they develop their clinical workflow. So even though their mission is to provide best-in-class care, the way they accomplish that is different from place to place. In some hospitals, there are mobile centers of excellence, or dedicated teams with a singular focus on mobile enablement. In many hospitals, mobility projects are owned chiefly by the IT department, or sometimes initiatives like secure messaging are undertaken by the telecom department. If either IT or telecom tries to tackle the mobility project by themselves, important viewpoints are going to be missing from the plan. So the thing that you're going to maybe get a little tired of, Jason and I are going to really try to highlight the fact that a cross-section of departments needs to be included in the planning. Involvement by all the departments is crucial to the ultimate success of the secure mobile communications. A recent survey that was done by Spoke said that nearly 60% have clinical leadership involved in mobility strategy planning. I think that's fantastic. I've been on some meetings recently in California where they had doctors involved in the team. They had a cross-section of departments. So they were really doing a great job of having cross-functional team members to build their mobility strategy planning. So whether you have your doctors, the nurses, what we're even seeing in some cases, I was out in Southern California recently, and there was a consultant in the room that had been hired. So there's a number of people that have to be included in developing the plan. The next slide kind of gives you a better understanding of who might be included in your teams. So if you had asked 10 or 15 years ago a SpectraLink or Spoke person, they would say almost primarily it was a telecom IT discussion when it was a wireless kind of a conversation. But what we're seeing now is that you really need a cross-section. So from an executive sponsorship standpoint, whether the executive sponsor is the CIO, the Chief Medical Information Officer, the Chief Nursing Informatics Officer, or the Chief Information Security Officer, and some other member of the leadership team, these key stakeholders provide several key purposes. They help keep the team focused on the larger organizational goals, and they hold the team members accountable, and that can be vital in securing the necessary funding for the overall project, because oftentimes money is borrowed from one budget from another, maybe to justify how they're going to pay for these mobility strategies. From a telecom perspective, members of the telecom or mobility team are the experts on the communications infrastructure. This is so important because it includes the understanding and storage of accessibility of contact data, such as key phone numbers, pager numbers if pagers are still being implemented, on-call schedules, the code team member lists, and much more. They are the experts on the existing communication pathways and the processes. IT has to be incorporated because they bring the expertise about the technology infrastructure, such as the Wi-Fi coverage or the Wi-Fi design, and how they can boost the cellular coverage, because oftentimes, as you all know, especially for people like the physicians that come in from outside the campus and depend on their cellular device, they want to make sure that not only is there solid Wi-Fi coverage within the campus, but there's also a strong cellular signal. So poor network coverage or the configuration and design can become the critical failure in an otherwise well-designed project. And a wireless network engineer is the key resource that can help prevent this from happening. I would tell you in my experience with voice over Wi-Fi that almost 90% of issues that are reported by customers are dependent upon the Wi-Fi infrastructure design and deployment, not the devices. So devices are a critical component, but if the Wi-Fi infrastructure is not designed and implemented properly, you'll have end users that just put the phone in the drawer and say, it's too frustrating, I'm not going to use that device. So IT experts need to be part of the research and to help vet the new technologies that are being considered to achieve the hospital's goals for mobility, as well as to give exceptional implementation support. Now, the clinical knowledge category is the emerging. This is really the important piece that I think I'm seeing more and more involvement from the clinical knowledge staff members. The doctors, the nurses, the other staff members provide their firsthand experience regarding the clinical workflow and how the work gets done, how the patient care is provided. They can give great insight into the practical challenges that they confront every day on the patient floors, and they need to be incorporated into the mobility planning. These are largely the end users of the mobile technologies outlined by the mobility strategy and include the perspective of how to plan to enhance the likelihood of success and address the concerns prior to technology implementation. And they also bring their perspective to the table when they design the strategies for achieving the established goals of the overall team. The security expertise is really another key part. You know, with a variety of wireless applications that are being utilized throughout the campus, enterprise mobility solutions, mobile device management, enterprise mobility management solutions help set up the security expertise for the mobility strategy. The need to keep PHI secure because of the HIPAA Act that came about back in the late 90s. HIPAA is usually well understood throughout the healthcare organization, but the details of the organization's plan and strategies relating to specifically from a security standpoint are not very well often understood by the team members. You need to incorporate into your employee training regarding email scams, ways to remote back to servers. There are many components to the security umbrella. And so that has to be a big part of the team's overall planning. Security expertise may already be represented by the Chief Information Security Officer, who might be the executive sponsor for the group, but involvement from all of the other team members to give input to the security team is necessary to verify that proposed mobility strategies comply with the security strategies that are in place. And finally, the consultant category is something that we see more and more often. They're brought on board for a number of different reasons. They can supplement the expertise that might be lacking from the internal hospital resources that might not be as aware of all the new emerging technologies that are available. They can assist in clarifying the overall mobile strategy objectives. They can help conduct the on-site interviews with the team members. They can research different kinds of technologies that might be available to meet the goals, and they can help design and implement effective mobile strategies using the industry's best practices for implementation. These professionals can also help with change management planning. I think what you're going to find if you don't have a mobility strategy in place now is the technology is such a big culture shift for your end users that these consultants can help develop change management processes to allow people to adjust to the new technologies that are going to enhance the clinical workflows. So the consultants can fill a lot of gaps, and they can guide the team not only planning for existing goals, but they can identify the longer-term needs and help you have continued success for your future planning. So now, I think, Paige, we're going to go to the second poll question.
We are. So you should see this question on your screen. The question is, what roles are involved in your mobility project planning? And you can select multiple. So the options are executive leadership, telecom, IT, physicians, nurses, and consultants. If you want to go ahead and select all that apply for your organization or your project. And we'll leave it open just a little bit longer here. It looks like we're getting a lot of responses in at the moment. And then we'll go ahead and close that up and share the results. So you should be able to see the results now, Alan.
Wow, how about that? So interesting that, you know, no surprise, telecom and IT are still very involved. It's great to see that the caregivers, the nurses, are so involved with a lot of the strategy planning that's going on. Obviously, executive leadership is very involved, followed by the doctors, and you know, a big contribution for consultants. So that's great. Any thoughts there, Jason?
This is definitely not surprising to see. I think the only thing that is interesting to me is there's a lot of involvement here. It seems on the nursing perspective, it seems like the physicians are not as involved. Now we titled this mobility project planning, so right, you can perceive that in, I guess, multiple different ways. But since this webinar is focused on talking about a lot of secure messaging, it's interesting to see not as many physicians being involved, or at least people stating that. Good to see such a high level of executive leadership involvement. I think that's really critical too. But definitely not too surprising to see such a high level of IT and telecom.
Great, I completely agree with you. So now, everybody, I'm going to pass over the slide deck over to Jason, and he's going to start sharing with you some comments about the process. Jason?
All right, thanks, Alan. A lot of great information there from Alan. So really just kind of extend on what Alan's talked about. We're going to talk about the process here and focus on how we can take this team that has these clearly defined goals and it's been staffed appropriately with all the various different viewpoints and get them ready to embark on more detailed planning. So let's take a look at these stats here in this slide. We can see that secure messaging is currently a primary driver. 84% of CIOs purchasing decisions being related to mobile applications. So that's a really high number. This is actually followed by electronic health record integrations at 83% in this particular survey. So we're seeing that secure messaging is actually driving more decisions related to mobile applications, even in the EHR, which is kind of surprising to me, but it just shows, it just illustrates